Okay, this is part two, although the slide doesn't say that, it's part two. And was picking up from where we left off with neurogenic bladders. So this is the neurogenic bladder kind of diagram showing the upper motor neuron versus the lower motor neuron. This is C2 lesions, and generally from C2 down to L to S1 are the upper motor neurons, so this is where lesions can be, how the bladder will act. So upper motor neurons, the detrusor muscle is hyperactive, whereas lower motor neuron, they are areflexic. So these are spinal cord injuries, C2 to 12, MS, transverse myelitis, Guillain-Barré, and then diseases of the brain can be stroke, brain injury, multiple sclerosis, hydrocephalus, cerebral palsy, Alzheimer's disease. And then the S1 disease below the sacrum, lower motor neuron, would be mild dysplasia, peripheral neuropathies, MS, TB dorsalis, syphilis, spinal cord injury, T12 to S1, and chordae equina syndrome, and herpes simplex and zoster infection of the spine. So overactive bladder, chronic syndrome of detrusor overactivity, sense of urgency. You have to worry about trying to confirm the diagnosis and modify lifestyle modifications and behavioral therapy. Bladder contraction, reduced strength is duration, prolonged bladder emptying, incomplete emptying. So this is underactive bladder caused by spinal cord injury, stroke, multiple sclerosis, weakened stream, inconsistency. Anatomic obstruction of urine flow, urethral strictures, prostrate ecological and pelvic. Maybe we show the diagram from before. And then we have now renal tumors. Renal adenomas are benign, and renal cell carcinomas are the malignant. All adenomas are benign, wherever they come from, colon, bladder, skin. So renal cell carcinoma is a manipulation of the hippo-lindau HLA gene located in chromosome 3p52. And some bladder tumors are urethral carcinomas. Risk factors are smoking, certain aromatic amines, arsenic in drinking water, and some chemicals and drugs. This is a picture of renal cell cancer. This is normal kidney. It's kind of filleted open, split open. You can see the startling difference between this and that. And this is renal cell carcinoma from a usually sophisticated person. That can all of a sudden has hematuria and sometimes pain. Bladder tumors have the oncogenes or RAS genes in the family that suppress the genes of T53. They have inactive RB gene and loss of head pregnancy and chromosome 9. The manifestations of bladder tumors are transient urethra, painless microscopic hematuria. It's classic. They have no pain, just represent much blood in the urine. And they usually, the treatment is TUR, laser ablation, sometimes intravascular injection of BCG, radical cystectomy, and adjuvant chemotherapy radiation. Location of tumor, so they can be anywhere, but the most common places are in the posterior wall. Okay, so urinary tract infections are inflammation of the urinary epithelium caused by bacteria and gut retrograde. Classifications are complicated, UTIs, uncomplicated UTIs, recurrent, ones that cause cystitis and pyelonephritis. Protective urinary mechanisms, washout of urethra, micturition, low pH, presence of certain proteins, secretion of the uroepithelium with bacterial effect, uterovesical junction close to reflux. Women has mucus secreting glands, and men have the male urethra, which is longer, and there's a Lewis blood group that protects against urinary infection. The most common pathogens are E. coli and staph. Virulent uropathogens' ability to evade and overwhelm the host mechanism that cause disease, adherence to epithelium, and ability of host defense. Cystitis is inflammation of the bladder, acute or chronic. Clinical manifestations: asymptomatic, dysuria, frequency, low back pain. That's something to think about when you have low back pain. Urinary culture of specific microorganisms and antimicrobial therapy. The mechanism to protect urinary tract from infection: monocytes, acid urine, decrease urine osmolarity, and the answer could be decrease urine osmolarity.